Work together with your loved one and his or her physician to develop a caregiving plan that includes how often you will visit and who can help provide housekeeping or other chores. Work with the Area Agency on Aging or other social service groups to find services for which you or your loved one may qualify and how you can access community-based services when the need arises. And ask your employer what assistance they can provide. Some companies pay for adult daycare and resource and referral hotlines, since these services have been shown to improve worker productivity. At a minimum, the Family Leave Act allows you to take up to 12 weeks of leave in any 12-month period to care for a parent with physical or mental concerns.
A common problem that comes up in planning for the future with older people is deciding whether they're able to stay in their home or might need to move to another setting. I think it's very important that families and older people talk about this in advance so that they have some ideas about what the person's personal resources are and what kind of options are available. And it's also good to involve the physician in the discussion, because the doctor should have some understanding of what is available in the community and might be able to help the older person and their family choose the right setting for that particular person based on what they're able to do for themselves. We do our very best in geriatric medicine to try to keep people at home as long as possible and bring resources into the home so people can stay at home. But when it gets to the point where it looks like that's just not going to work any longer, then fortunately in most larger communities nowadays we have a lot of choices for older people. There are ways that people can spend time in daycare programs. People can go to settings that are called assisted living settings, where they actually live in their own apartment and have their own kitchen but have some support if they need it. And then lastly, everybody knows about nursing facilities, and nursing homes have changed a lot over the years, and there are many excellent nursing homes now in the United States. And these homes are the right choice for some people depending on what kind of help they need. But planning ahead is crucial. If you don't plan ahead, your choices are limited. A lot of the best places have long waiting lists, and you need to put your name on those waiting lists in advance of when you might need to use that type of living situation. A lot of people don't want to think about it. They just want to put it off to the last minute because the idea of leaving their home is so painful. They really don't want to think about the future. What I always tell people is put your name on some waiting lists. If your name comes up and you're not ready to move, just tell them to put it back at the bottom of the list. And nobody's going to force you to move when your name comes up. But in our community where I work, the best places, sometimes it takes a year to get to the top of the list.
Once the decision has been made, then certainly if you're looking at a facility, you would want to look at facilities that have good reputations. There's no substitute for good word of mouth. Certainly contacting the state agencies in terms of facilities they would recommend, the Administration on Aging, and other community agencies.
You may want to base your decisions on proximity to family and friends, special services, ratio of nurses to patients, who the medical director is, and if your doctor will follow you there. Make sure that culturally and spiritually the facility meets your needs. And do a surprise visit to see if the residents seem happy, the staff supportive and caring, the food looks good, and if the facility looks and smells clean.
Where older people are living has changed dramatically in the last 10 years. There are now many more options for staying in your own home. Reverse mortgages are a way of taking the money that you have invested in your own home and getting an income from that so that you can stay there and make whatever modifications are necessary.
Talk with your loved one about how you feel about staying in your home and what resources are available to help you accomplish that goal. Work with an attorney or a financial planner who is an expert in elder law to write a living will, a healthcare power of attorney, and other legal documents